My name is Abraham Peled. I'm a psychiatrist, and for many years I'm trying to reconceptualize mental disorders as brain disorders. And in previous videos, we talked about personality, how personality might be generated as a lifetime experience of what we call experience-dependent plasticity. We also talked about personality disorders as disorders and disturbances of experience-dependent plasticity, in the sense that unstable experiences can hamper the optimal organization of default mode network, which represents the internal representations of self and others and complex interpersonal relationships. So now when we want to talk about treatment, we can base treatment, actually we can explain to ourselves how psychotherapy, being an experience-dependent plasticity process, is actually efficient in treating these patients. And what happens in psychotherapy actually is that the interactions between the therapist and the patient are constant and repeated. And being constant and repeated, there are actually a set of inputs or set of events which are experience-dependent plasticity events, in the sense that it's an experience that is repeated, and it influences the way the person views himself and others, meaning that there are plasticity changes, there are changes in the internal representations. And this can be explained using the Hebbian algorithm that we talked about. When two neurons fire together, they wire together, sets of neurons wire together when they fire together, and in the psychotherapy session, many activations are controlled by the experienced therapist, by experiencing different ways of looking at things and experiencing self and other and the interactions within the psychotherapy session. All of these are experience-dependent plasticity process. So there is an experience, and when it repeats continually, it becomes, based on Hebbian algorithm, plasticity change. So we can understand now how psychotherapy, talking therapy, is actually a biological brain organization, Hebbian algorithm, Hebbian dynamic, or Hebbian ensemble generating process. So there's nothing new in that, but how can now our intuition about experience-dependent plasticity therapy can be relevant to new ways of treating these patients? So one thing would be plasticity. If plasticity could be increased, we know that plasticity of a young child is different than that of an old person. So if we can make the brain plastic as a 3-year-old or 4-year-old child, then the experience-dependent process of education and experiencing could be recruited, and the process of psychotherapy, when done on such a brain, on a childlike plasticity brain, then probably the achievements that you can achieve in psychotherapy that might take 2 years or 3 years or long periods could be in a plastic brain could take only 3 weeks or months, and you can actually increase the ability to change the brain. So one thing I might think of, looking at the personality disorders in terms of brain-related experience-dependent plasticity and construction of the default mode network, would be to increase plasticity and on top of that generate an experience-dependent process that you can control. And today we also have technologies that can control your experiences, like virtual reality, where you project a person to have an experience that you can control, even a psychosocial experience with other humanoids in the virtual reality environment that you can control, and by repeating them, you can generate an experience-dependent plasticity situation tailored personally to that patient and to that specific disturbance that the patient has in his past experience. So you can map out the previous experiences, generate an internal representation of how he views himself and others. That would be like the dynamic psychotherapeutic diagnostics that you do today. And if you have an ability to make the brain more plastic and you know exactly which disturbances to target, which experiences to manipulate, then you can increase many degrees the efficacy of treating personality disorders. So this is how we can advance a little bit more ahead if we understand what is actually personality disorders and their therapeutic efficacies. You can register to my website to read more about it, brainprofiler.online, and follow my channel Neuroanalysis, and see you in future.